Today we're going to talk about a plastic surgery complication, namely blood clots. So the blood clots we're going to talk about today, those are typically areas where the blood has congealed, form a clot, typically in a large vein, usually in the leg, that can break free and be carried out to the heart and then to the lung. We call that a pulmonary embolism. These are rare complications, thankfully, for elective surgery. However, there is risk that is involved, and we're going to talk about that specifically as it regards to tummy tucks. Now, why are we talking about tummy tucks? Well, let's talk about risk of blood clots with surgery in general. If you're looking at the world of surgery, there is a stratification for risks of forming blood clots based on the type of procedure, with some procedures being higher risk for forming blood clots and some procedures, like mine, being low risk. And I like to think of that as a safe and unsafe car, right? Some procedures are unsafe cars and some procedures are safer cars. And in that world of surgeries, I have a little bubble here of cosmetic breast and body surgeries, and all the surgeries that I do are considered low risk or safe cars. Now, with blood clot risk with surgery, it's not all about the surgery itself. The patient themselves can have risk of forming blood clots, pre-existing risk and risk after surgery. And so that has to be accounted for as well. And I like to think of that as a safe or unsafe driver. Some patients have high risk for blood clots and they're unsafe drivers. Some patients have very few risks for blood clots and are relatively safer drivers. So now let's give some numbers to it. So recently there was a large review of patients undergoing tummy tuck surgery in the United States who did and did not develop blood clots, and they were looking at that. They found that all the patients undergoing the tummy tucks in the United States had a 0.8% risk of forming a blood clot or a pulmonary embolism. They also found that if you combine tummy tuck with any other procedure like liposuction, which I often do, it does increase the risk of a blood clot. Now let's put those numbers in perspective. That's a national number, so it does include patients who are both high risk for blood clots and low risk for blood clots, right? It's combining safe and unsafe drivers. Most of my patients who undergo tummy tuck surgery are all considered safe drivers. So those numbers, I would argue, are likely inflated by patients who are unsafe drivers, right? There are patients who are predisposed to forming blood clots and form a blood clot after surgery, and so it raises the overall number for the population. But if you're a low-risk patient for blood clots, which the vast majority of my patients are, then your number should be less than that. I hope that analogy of safe and unsafe car and safe and unsafe driver helps you put it in perspective as far as risk of blood clots with tummy tuck surgery. This is something that I go over with all my patients at a preoperative visit because it's so important. Even though it's a rare complication, it has serious implications, and so it deserves to be chatted about. So how do you know if you are a safe or unsafe driver for blood clots? Well, you actually need to visit with your plastic surgeon to talk about it. But there are known risk factors that increase your risk for blood clots, both pre-existing that are specific to you as a patient, and some of those can be changed and some of those can't be changed, right? One of them that can't be changed is your age. As you get older, there's inherently increased risk for blood clots. Your body composition can be changed, and that could change your risk factors. Taking exogenous or extra hormone replacement therapy is also something that might be able to be changed. So there are factors that need to be looked at, both that are unchangeable and then some that you might actually be able to influence prior to surgery. Maybe you should consider it. And so that's why it's important to discuss this with your plastic surgeon ahead of time. Hope this helps. If you have any other questions about plastic surgery, complications, outcomes, whatever, leave us a line, give us a call. We'd be happy to discuss it with you.